Thank you very much for the invitation to talk to you at this forum regarding the medical therapy in aortic valve stenosis. And I'll be talking to you mostly about our trial called EVOID-AS trials. And I do have a few disclosures, as you see in this particular slide. This slide shows a very complex mechanism of aortic valve fibrosis and calcification. And it starts with endothelial injury to the valve, and then that leads to inflammation, and then calcification and fibrosis, and severe aortic valve stenosis. And we do have several potential targets that we can use medical therapy to reduce the progression of aortic valve stenosis, as you see in this slide on your right side. And as you know, we had several clinical trials using this medication, especially the statin at the top for oxidized lipids, and also the most recently bisphosphonate, denosumab, and vitamin K and D. Those clinical trials actually failed to show any impact on reducing aortic valve calcification or stenosis. There are still a few medical trials ongoing using PCSK9 inhibitors, niacin, and also the DP4 inhibition, which is the focus of my presentation. So EVOID-AS trial, that stands for the evaluation of efficacy of evogliptin in delaying progression of calcific aortic valve stenosis. And this particular trial was based on this publication from Korea in 2017, and showing that DPP4, dipeptidyl peptidase 4, induces aortic valve calcification by inhibiting insulin-like growth factor 1 signaling in valvular interstitial cells. So if you look at the mechanism of aortic valve calcification with the valve injury or valvular interstitial cells injury, that gets differentiated into the osteoblast-like cells, and that becomes calcified. But that process is blocked or attenuated by the IGF-1. But after the endothelial injury, as you see it here, that the activity or expression of DPP4, dipeptidyl peptidase 4, expression increases, and that expression increase attenuates the activities of IGF by degrading that. So if we can inhibit the DPP4 by DPP4 inhibition, we can increase or maintain the activity of IGF-1, and that'll block the differentiation of the valvular interstitial cell to the osteoblast-like cells, and so there's less aortic valve calcification. So investigators also show in animal model that when the rabbit model, in this case, fed with a cholesterol and vitamin D diet, you can see compared to the normal diet on the left, there's significant calcifications here, but when the DPP4 inhibitor, in this case sitagliptin, was added to the diet, there's much less calcification on echocardiography, and also the aortic valve velocity increase is much less after the DPP4 inhibition was added to the diet. And also the same investigator show retrospectively in patients with diabetes and also aortic valve stenosis together, if they take a certain favorable DPP4 inhibitor, the progression of the aortic valve velocity increase is much less than the patients with no DPP4 inhibition medications or non-favorable DPP4 inhibition. Because you can see here that of 8 different DPP4 inhibitor, or the gliptin drugs, when they look at the heart and plasma medication concentration ratio, you can see that almost a 4-fold difference with the evogliptin as a medication with the highest concentration. So we decided to use evogliptin as our medication in these clinical trials to see whether this has an impact in reducing the progression of the aortic valve calcification and also hemodynamic changes of the aortic valve. So the DPP-4 inhibitors are been used as a diabetic medication, and then evogliptin been used several years already in Asian countries and also South America, but not available in the U.S. So we obtained FDA approval in 2020 for this clinical trial to reposition the use of this medication for the calcific aortic valve disease. So our trial design is double-blinded, adaptive phase 2 and 3 combined, and the multi-center trials up to 45 clinical sites. And we are working as the overseeing the clinical center, and I'm working as the national PI. And we randomize the patients to 3 different arms, 2 medication arms and 1 placebo. And we hope to recruit 867 patients with a mild to moderate aortic valve stenosis over the next 3 years with a 2-year of active treatment period. And inclusion criteria then, they need to have an echocardiographic demonstration of the mean gradient between 10 and 30 millimeter mercury and aortic valve area of 1.2 to 2.0 square centimeters. And then the non-contrast, the CT showing the aortic valve calcium score of a 200 arbitrary unit or higher. And once they meet this entry criteria by echocardiography and CT and also the clinical data, then they are randomized to these 3 arms as I show you in this slide. We have many exclusion criteria. We just want to make sure that patients do have a preserved ejection fraction and no significant heart failure and no significant renal disease. And initially, we also excluded patients with a diabetes mellitus because we worried that the additional DPP-4 inhibitor may make patients hypoglycemic, but we realized that the almost 50% of patients with aortic valve stenosis do have a diabetes, and also so far we have recruited 120-some patients that hypoglycemia has not been a problem, and our consultant in this particular trial in endocrinology assured us that the adding DPP-4 inhibitions to other diabetic medications will not cause significant hypoglycemia. So we are in process of changing our protocol to include patients with the diabetes mellitus. And also, initially we excluded patients who are on the vitamin K and bisphosphonate because of their potential mechanism. But with the recent data showing no impact of this medication on the aortic valve calcification progression, we also eliminate them as a exclusion criteria. Our primary objective of the data is to see the reduction of progression of aortic valve calcification as assessed by the CT over 2 years, and the secondary objectives are the reduction of a progression of the aortic valve severity, evaluated by the echocardiography over 2 years, and also we'd like to make sure that this medication is safe. As I mentioned already, we like to have 289 patients per each arms. That is a total of 367 patients with the expectation of a 15% dropout rate. And then also this was based on our assumption that 25% relative reduction in CT calcium score over 2 years, and that'll delay the progression of aortic valve stenosis from mild to severe 5 to 7 years. And if we can enroll, 1 or 2 patients per month, that'll be really fantastic. But if you can do 1 patient per week, that'll be really super fantastic for these particular trials. Patients will have a 4 in-person visit and also about 6 to 7 virtual visit during the study period. And as you know, we also have several ongoing medical trials using atorvastatin, niacin, PCSK9 inhibitors, atazigua, and also some medications I may not be aware of. And I hope that one or several of these medications are effective in reducing the progression of aortic valve stenosis, so that we can reduce the burden of this aortic valve stenosis in patients and also in our medical community. Thank you so much for listening. And as we are discussing, I'm actually in Hawaii enjoying the nice weather, but I'm happy to join you for a discussion later. Thank you so much.